Assalamu alaikum. Hello dear viewers, once again. So welcome to my new lecture. So today we will discuss about the topical antifungal agents. As in previous lectures we have already talked about the different systemic antifungal agents. So in topical antifungal agents, it is classified into different categories: azole antifungal or topical antifungal agents. So it include Econazoles, gentian violet, niftyphines, oxyconazole and cetacanazoles. Topical antifungal agents, they are used to treat a variety of mycosis of skin and mucous membrane. Some systemic antifungal have topical forms. Fungi causing these mycoses are called dermatophytes. Come toward the therapeutic actions of topical antifungal agents. The desired and beneficial action of topical antifungal agent is it can alter or change the cell permeability of the fungus, which causing the prevention of replication and fungal death. The clinical indication of topical antifungal agents. So topical antifungal agents, so they are indicated for the local treatment for mycosis, including tinea infections. Tinea infections like tinea corporis, tinea versicolars, tinea manium, tinea pedis, and tinea versicolars, and many more. These drugs are contraindicated, especially when there is known allergy to the topical antifungals. Sometimes the patients, they are very sensitive to topical antifungal agents. So if these antifungal agents are used, so it can cause certain type of allergic reaction on the skin. Econazoles can cause intense local burning and irritations. Drugs should be discontinued upon evidence of these manifestations. Gentian violet, it stains skin and clothing bright purple, so it can be also very toxic, so it should be applied near actual lesions. Niftyphines, oxyconazoles and cetacanazoles, so it shouldn't be used for the longer than 4 weeks due to risk of adverse effects and possible emergency of resistant fungal strains. Cetaconazole shouldn't be used for the longer than 6 weeks for the same reason. Adverse effects which are reported by the topical antifungal agents, so use of topical antifungals may result these adverse effects: local irritation, burning, rash, swelling may be occurs. In GI tract, gastrointestinal tract, it causing nausea, vomiting and hepatic dysfunction, especially when they are taken as suppositories or surgeries. Gastrourinary frequency, burning and change in sexual activity related to local absorptions and the vagina. Other antifungal agents, they are also used like other antifungal agents include tolnafat and andesylenic acids, benzoic acid and haloprogens. Clinical indication of tolnafat is supplied as a cream powder, spray and liquid aerosols. Tolnafat, so it is used to treat fungal condition like jock itch and athlete's foot and ringworm. Cyclophyrox is indicated, which is another antifungal agent. Topically, it is for the treatment of tinea pedis and tinea corporis due to trichophyton rubrum and trichophyton mentagophytes and epidermophyton flocosum, as well as seborrheic dermatitis. So this drug is very effective and these conditions. Haloprogens as antifungal agents used to treat tinea infections of the skin. These drugs shouldn't be used especially in eyes or vagina, and nursing women should consult their doctors before use. The side effects which are reported by the different literature, so side effects in the form of irritations, may be chance of burnings and vesiculation. So blisters appear on your skins, scaling and itching. So these are also the side effects. Classification based on structure, so that include antibiotics. So an antibiotic Pauline can be given to the patients like amphotericin, nystatin and mycins, while heterocyclic benzofuran like grasoparvens, grasofulvins, and anti-metabolite like plocytosine. So an azole, imidazole, ketoconazole are clotrimazole, and oxyconazoles and miconazole. So these are the drugs. While the triazole include fluconazole, atraconazole and voriconazoles. Elements include terbinafine and butanafines, while the echinocandins include caspofungins and enidolafungins and micafungins, while the other topical agents are tolneptate and andicyclinic acid and benzoic acid as well. This is the mixed classification. You can see here the first one is inhibitor of cell membrane and its functions. For example, drugs that can affecting the cell membrane function like paulines, nystatin, amphotericin B. While the B inhibitor of ergosterol synthesis, they are first one is azole. So imidazole include clotrimazole, miconazole and ketoconazole, while the triazole include atraconazole, posaconazoles and fluconazole and voriconazole, while the second one is elylamines, that is include terbinafine and tolneptate, while the, another one is 3 marpolines, amorelphines, they are not explained, while the second one is inhibitor of DNA and RNA function, that is plocytosine grasofulvin, while the third one is inhibitors of cell wall function, that is echinocandin or caspofungin. This is a general classification of antifungal drugs along with its mechanism. So after that, inshallah, I will summarize the whole antifungal drugs, and these material or these contents are taken from Lippincott Pharmacology. Thank you so much for watching my lecture.